5 health checkups you should avoid after 70 that may harm you more than help. There's a hidden truth that most seniors will never hear from their doctors. Every year, millions of seniors line up for health checkups thinking they're staying safe. But what if I told you that some of those tests, the routine ones your doctor says you need, could actually push you closer to surgery, stroke, or even cancer? New studies reveal that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, over half of older adults have no idea they're being overtested. One of these checkups, the number one on our list, actually causes thousands of cancer cases in the US every single year. You won't hear this from your clinic, you won't see it on a billboard, but the truth is buried in the science. And today, we're uncovering it all. In this video, the 5 health checkups you should avoid after 70, and the terrifying truth about what they can do to your body. All backed by real science, and you won't believe what made it to number 2. Before we begin, let us know in the comments below where you're watching from, your age, and have you ever regretted a test or procedure? Do you think seniors are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more videos like this. Now, without any further ado, let's talk about the first test. Why it looks harmless, but could quietly ruin your quality of life. Checkup number 5, routine colonoscopy. Number 5, routine colonoscopy after 75. It sounds like common sense. A simple scope, some sedation, and you wake up knowing whether your colon is healthy. For decades, doctors have recommended this test every 10 years, and it's saved countless lives by catching colon cancer early. But here's what no one tells you. Past the age of 75, especially if you've already had clear results in your 60s and early 70s, a colonoscopy can create more danger than protection. The procedure itself involves threading a flexible camera through your entire colon while you're sedated. Doctors look for polyps, small growths that could turn cancerous over time. But in older adults, especially those over 75, the risks start to outweigh the benefits. The colon becomes more fragile with age, the walls thin, scar tissue from previous surgeries or diverticular disease makes the tissue stiff and harder to navigate safely. And that's when perforation happens. Perforation means the scope accidentally pokes a hole through the colon wall. It's rare, but in seniors, it's not rare enough. A study published in the Journal of the American Medical Association in 2020 found that patients 75 and older face twice the risk of complications compared to those in their 50s. Among patients over 80, the risk of emergency department visits and hospitalization after colonoscopy jumps to 3.5%. That's not a minor number when you're talking about a screening test that's supposed to prevent problems, not create them. And here's the uncomfortable reality. If you've had regular colonoscopies throughout your life, and they've all come back clean, the chance of developing colon cancer in your late 70s or 80s is extremely low. According to the National Cancer Institute, most colorectal cancers grow slowly. It can take 10 to 15 years for a polyp to turn into cancer. So, if you're 78 years old and your last scope at 68 was clear, you're statistically very unlikely to develop a life-threatening cancer before age 88. Yet many doctors still recommend the test, and seniors, trusting the system, agree. Let me tell you about Harold, an 82-year-old man who came into our office after a routine colonoscopy. He'd had 3 previous colonoscopies in his life, all clear. His doctor suggested another one, just to be safe. Harold had no symptoms, no blood in his stool, no abdominal pain, no family history of colon cancer. He was healthy, active, and walked 3 miles every morning. During the procedure, the scope perforated his sigmoid colon. Within hours, he was in the operating room for emergency surgery. The surgery went well, but the recovery didn't. He developed a post-operative infection, spent 2 weeks in the hospital, and lost 15 pounds. By the time he came home, his confidence was shattered. He stopped walking. His wife told us he became fearful of his own body. That single preventive test, the one that was supposed to keep him safe, stole 6 months of his life. Now, this doesn't mean colonoscopies are bad. For people in their 50s and 60s, especially those with risk factors like family history, inflammatory bowel disease, or concerning symptoms, colonoscopies are life-saving. But after 75, especially if you've been screened regularly and have no symptoms, the calculus changes. The American Cancer Society and the US Preventive Services Task Force both say that screening can stop at 75 for people with average risk and previous normal results. So what's the alternative? If you're over 75 and your doctor recommends a colonoscopy, ask these questions. When was my last colonoscopy, and what were the results? Do I have any symptoms or risk factors that make this necessary? Are there non-invasive alternatives like a stool-based test that could give us information without the risks? Stool tests like FIT or Cologuard can detect blood or abnormal DNA in your stool, signs of potential cancer, without any sedation or perforation risk. They're not perfect, but for low-risk seniors, they offer a safer middle ground. And if those tests come back normal, you've avoided unnecessary danger. If they come back abnormal, then you can make an informed decision about whether a colonoscopy is worth the risk. Don't let fear or routine push you into a test that could do more harm than good. But colonoscopy isn't the only screening that can backfire. There's another test that's even more common, and for many seniors, it leads to treatments that destroy quality of life without extending it. Checkup number 4, PSA screening for prostate cancer. Let's talk about that next. Number 4, PSA screening for prostate cancer in men over 70. The PSA test, short for prostate-specific antigen, measures a protein in your blood that can be elevated when you have prostate cancer. It's quick, simple, just a blood draw, and for years, it was considered the gold standard for catching prostate cancer early. But here's the uncomfortable truth. In men over 70, especially those with no symptoms, PSA screening often creates more fear, more treatment, and more complications than it prevents deaths. Here's why. Prostate cancer in older men is usually slow-growing. Most men who are diagnosed with prostate cancer after 70 will die with it, not from it. According to research published in the Journal of the American Medical Association in 2023, nearly 70% of men over 70 who are diagnosed with low-risk prostate cancer will never experience symptoms or harm from the disease in their lifetime. But once that PSA number comes back elevated, the medical cascade begins. An elevated PSA doesn't mean you have cancer. It can be elevated because of an enlarged prostate, a urinary infection, recent sexual activity, or even riding a bike. But the number triggers anxiety, and anxiety leads to a biopsy. The biopsy involves inserting a needle through the rectal wall into the prostate to extract tissue samples. It's invasive, painful, and carries risks like infection, bleeding, and in rare cases, sepsis, a life-threatening blood infection. And here's where it gets worse. Many of those biopsies find cancer that would never have caused harm. But the word cancer is terrifying, and most men, understandably, want it out. So they undergo treatment, radiation, surgery, or hormone therapy. Each comes with devastating side effects. Incontinence, where you can't control your bladder. Impotence, where sexual function is permanently lost. Bowel damage from radiation that causes chronic diarrhea and pain. A 2024 study from the Journal of Urology followed over 1,400 men over 70 who underwent PSA screening. It found that for every one man whose life was saved by early detection, 8 men were overdiagnosed and overtreated for cancers that would never have harmed them. And those 8 men experienced complications that permanently reduced their quality of life. Let me tell you about Leonard, a 74-year-old retired firefighter. He had no urinary symptoms, no pain, nothing concerning. But at his annual checkup, his doctor ordered a PSA test. It came back at 5.2, slightly elevated. His doctor referred him to a urologist who recommended a biopsy. Leonard was terrified. He imagined cancer spreading, imagined leaving his wife and grandchildren. The biopsy found a small area of low-grade cancer, Gleason score 6, the least aggressive type. His urologist recommended surgery. Leonard trusted him. He had his prostate removed. The surgery went smoothly, but the recovery was brutal. He developed urinary incontinence and had to wear pads for over a year. His sexual function never returned. When we finally saw him 2 years later, he told us, I wish I'd never taken that test. I had no symptoms. Now I can't live a normal life. And they told me afterward that the cancer probably wouldn't have killed me anyway. The US Preventive Services Task Force, the American Urological Association, and multiple other medical organizations now recommend against routine PSA screening in men over 70. The risk of false positives is too high, the risk of overdiagnosis is too great, and the evidence shows little to no benefit in reducing prostate cancer deaths in this age group. So what should you do? If you're a man over 70 and your doctor suggests a PSA test, ask these questions. Do I have symptoms like difficulty urinating, blood in my urine, or pelvic pain? What's my life expectancy based on my overall health? If I have slow-growing prostate cancer, would it affect my life in the years I have left? Can we consider active surveillance instead of immediate treatment if cancer is found? Active surveillance means monitoring the cancer with periodic exams and tests, but not treating it unless it shows signs of growing or spreading. For many older men with low-risk prostate cancer, this approach allows them to live their remaining years without the devastating side effects of treatment. Your prostate is not a ticking time bomb. In most cases after 70, it's a sleeping giant that will never wake up. Don't let a single blood test number rob you of your dignity and quality of life. But there's one screening that's even more common, and the overdiagnosis problem is so severe that it's now considered one of the biggest controversies in senior healthcare. Checkup number 3. Mammography screening after 75. Before we get to number 2, let's talk about number 3. Mammography screening in women after 75. For decades, mammograms have been promoted as the key to catching breast cancer early. And for women in their 40s, 50s, and 60s, that's often true. Early detection saves lives when the cancer is aggressive and the woman has decades ahead of her. But after 75, the story changes dramatically. And the data on overdiagnosis is staggering. Overdiagnosis means detecting a cancer that would never have caused symptoms or death if left alone. These are slow-growing tumors that, in an older woman with limited life expectancy, would simply never progress to the point of causing harm. But once they're detected on a mammogram, they trigger biopsies, lumpectomies, radiation, chemotherapy, and hormone therapy. All of this for cancers that would have quietly stayed dormant. A landmark study published by the National Cancer Institute in 2023 analyzed thousands of older women who underwent routine mammography. The findings were shocking. Among women aged 70 to 74, an estimated 31% of detected breast cancers were overdiagnosed. For women aged 75 to 84, that number jumped to 47%. And for women 85 and older, a staggering 54% of screen-detected breast cancers would never have caused harm. Think about that. More than half of the breast cancers found in women over 85 through mammography screening would never have made them sick. But those women underwent treatment anyway. They endured surgeries, radiation burns, nausea from chemotherapy, and the psychological trauma of a cancer diagnosis, all for tumors that posed no real threat. The problem is that mammograms can't tell the difference between aggressive cancers and slow-growing ones. They detect abnormalities, and those abnormalities demand action. Doctors can't ignore them, even if they suspect the cancer is indolent. The system is built to treat, not to wait, and that's where the harm happens. Let me tell you about Margaret, an 81-year-old woman who loved gardening and volunteering at her church. She had no breast symptoms, no lumps, no pain. But her primary care doctor encouraged her to get a mammogram, just to be safe. The mammogram found a small tumor, less than 1 centimeter. A biopsy confirmed it was cancer, estrogen receptor positive, slow growing. Her oncologist recommended a lumpectomy, followed by 6 weeks of daily radiation. Margaret agreed, trusting the system. The surgery left her with chronic pain in her chest wall. The radiation caused severe skin burns that took months to heal. She stopped gardening because lifting hurt too much. She stopped volunteering because she was too exhausted. By the time we met her, she was depressed, isolated, and filled with regret. "I was fine before that mammogram," she told us. "I had no symptoms. Now I feel like I'm falling apart. And my doctor told me the cancer was so small and slow growing that it probably wouldn't have affected me in my lifetime." So why did I go through all of this? According to a 2024 Yale medicine study, about 1 in 3 women over 70 who undergo mammography screening will experience a false positive result, meaning the mammogram detects something suspicious that turns out not to be cancer after further testing. But those false positives cause immense anxiety and lead to unnecessary biopsies, each with their own risks of infection, bleeding, and scarring. So what's the alternative? The US Preventive Services Task Force does not recommend routine mammography for women over 75 unless they have specific risk factors like a strong family history of breast cancer, genetic mutations like BRCA1 or BRCA2, or concerning symptoms like a new lump or bloody nipple discharge. If you're a woman over 75 and your doctor suggests a mammogram, ask these questions. Do I have symptoms or risk factors that make this necessary? What's my life expectancy based on my overall health? If a cancer is found, would I be willing and able to undergo treatment? What are the chances that any cancer detected would actually harm me in my remaining years? These are hard conversations, but they're essential. Breast cancer screening is not a one-size-fits-all recommendation. After 75, the risks of overdiagnosis and overtreatment often outweigh the benefits of early detection. You deserve to make an informed choice, not just follow a routine recommendation that may no longer serve you. But as serious as those first 3 are, the next 2 are even more concerning. Number 2 on our list is a test that millions of seniors get without question, and it's leading to dangerous, invasive procedures at an alarming rate. Checkup number 2, routine annual EKG. Number 2, routine annual EKG for asymptomatic seniors. An electrocardiogram, or EKG, measures the electrical activity of your heart. It's quick, painless, and often included as part of an annual physical. Doctors use it to detect irregular heart rhythms, signs of past heart attacks, or structural heart problems. And for people with symptoms like chest pain, shortness of breath, or palpitations, an EKG is absolutely essential. But for seniors over 70 who have no symptoms, no history of heart disease, and no concerning risk factors, routine annual EKGs often do more harm than good. Here's the problem. The older you get, the more likely your EKG will show minor abnormalities that are completely normal for your age. Small changes in the heart's electrical patterns, slight irregularities, or benign variations that mean nothing. But once those abnormalities are documented, they can't be ignored. Your doctor sees them and feels obligated to investigate further. That's when the cascade begins. You're referred to a cardiologist. The cardiologist orders a stress test, an echocardiogram, or even a cardiac catheterization, an invasive procedure where a thin tube is threaded through your blood vessels into your heart. Each of these tests carries risks. Stress tests can trigger actual heart attacks in vulnerable patients. Cardiac catheterization can cause bleeding, infection, blood vessel damage, or stroke. And in many cases, all of these tests confirm what was already true. You didn't have a heart problem to begin with. A 2018 study by the American College of Cardiology found that routine EKG screening in asymptomatic adults at low risk of cardiovascular disease rarely provides useful information and frequently leads to false positive results. According to their research, up to 39% of automatically interpreted EKGs contain errors, with more than half being false positives that suggest problems where none exist. And here's the kicker. The US Preventive Services Task Force explicitly recommends against routine EKG screening in asymptomatic adults, stating that the potential harms from unnecessary follow-up testing outweigh any potential benefits. Yet millions of seniors still receive annual EKGs as part of their routine checkups, simply because it's become a standard practice. Let me tell you about Evelyn, a 77-year-old woman who walked 2 miles every day, had no chest pain, no shortness of breath, and no family history of heart disease. At her annual physical, her doctor ordered a routine EKG. It showed a minor abnormality, something called a non-specific STT wave change, which can be a completely benign finding in older adults. But her doctor referred her to a cardiologist to be cautious. The cardiologist ordered a stress test. During the test, Evelyn's heart rate increased as expected, but the monitor showed another minor abnormality. Now the cardiologist was concerned. He recommended a cardiac catheterization to rule out blockages. Evelyn was terrified, but trusted the process. During the catheterization, there was a complication. The catheter nicked a blood vessel, causing internal bleeding. Evelyn had to be hospitalized for 4 days. She developed anxiety around medical procedures and stopped her daily walks out of fear. When we saw her months later, she was depressed, sedentary, and her overall health had declined. All because of a routine EKG that detected a benign finding in a woman with no symptoms. The truth is, if you're over 70 and have no symptoms, no history of heart disease, and you're managing your blood pressure, cholesterol, and diabetes if you have it, a routine EKG adds very little value. Your risk factors and symptoms tell a much clearer story than a single snapshot of your heart's electrical activity on a random Tuesday morning. So what should you do? If your doctor suggests an annual EKG and you have no symptoms, ask these questions. Do I have symptoms like chest pain, shortness of breath, or palpitations that make this necessary? Do I have risk factors like uncontrolled high blood pressure, diabetes, or a family history of heart disease? What would we do differently if the EKG shows an abnormality? Are there safer ways to monitor my heart health, like checking my blood pressure regularly and managing my lifestyle? For most asymptomatic seniors, the best heart disease prevention doesn't come from an EKG. It comes from controlling blood pressure, staying active, eating a heart-healthy diet rich in vegetables, whole grains, and lean protein, and avoiding smoking. Those lifestyle factors have been proven to reduce heart disease risk far more effectively than any screening test. But as concerning as routine EKGs are, there's one test that's even more dangerous. And it's the #1 culprit on our list. Checkup number 1. Routine CT scans. Number 1. Routine CT scans, especially whole body or chest CT scans. This is the test that causes thousands of cancers every single year, and most seniors have no idea. CT scans, or computed tomography scans, use X-rays to create detailed images of the inside of your body. They're incredibly useful in emergency situations, for diagnosing serious conditions, or for monitoring known diseases. But over the past 2 decades, their use has exploded, and seniors are being exposed to dangerous levels of radiation from repeated scans that are often unnecessary. Here's the terrifying truth. A single CT scan can expose you to 10 to 15 times more radiation than a standard X-ray. And unlike X-rays, which deliver a quick burst, CT scans deliver sustained radiation exposure as the machine rotates around your body, taking hundreds of images. That radiation damages your DNA, and damaged DNA can lead to cancer. A groundbreaking study published in JAMA Internal Medicine in 2025 analyzed CT scans performed in 2023 and projected their long-term impact. The researchers estimated that those scans would lead to over 100,000 future cancer cases. That's not a typo. Over 100,000 cancers caused directly by medical imaging. The study found that cumulative radiation exposure from multiple CT scans over time significantly increases the risk of developing cancers, particularly leukemia, lung cancer, and thyroid cancer. Another major study in 2022, published in BMJ, tracked adults who underwent CT scans and found a clear dose-related association. The more CT scans you receive, the higher your cancer risk. For patients who had multiple CT scans, the increase in cancer risk ranged from 2.7% to 12%, depending on the number of scans and the areas of the body imaged. And here's what makes this particularly dangerous for seniors. Many doctors order CT scans as part of routine screenings, especially lung CT scans for long-time smokers, or whole-body scans marketed as preventive health checks. These scans are often done annually or even more frequently. Each scan adds to your cumulative radiation exposure, and each dose of radiation increases your cancer risk. But it gets worse. CT scans frequently detect incidental findings, meaning they find something unexpected that may look concerning but is actually harmless. A small nodule in your lung, a spot on your liver, a shadow on your kidney. These findings trigger more tests, more scans, more radiation, and more anxiety. In many cases, after months of follow-up imaging and biopsies, The findings turn out to be benign, but the damage is done. You've been exposed to massive amounts of radiation chasing a ghost. Let me tell you about Robert, a 73-year-old man who smoked for 30 years but quit at age 55. His doctor recommended annual low-dose CT scans to screen for lung cancer. Robert agreed, thinking it was the responsible thing to do. Over 5 years, he had 5 CT scans. On the 4th scan, the radiologist noted a small nodule, 4 millimeters, in his right lung. His doctor ordered follow-up scans every 3 months to monitor it. Over the next year, Robert had 4 more CT scans. The nodule didn't change. Eventually, a biopsy was performed. It was benign, just scar tissue from an old infection. But Robert had received 9 CT scans in 6 years. According to radiation exposure calculations, he'd received the equivalent of over 450 chest X-rays. His cumulative radiation exposure had significantly increased his risk of developing a radiation-induced cancer later in life. And here's the bitter irony. If Robert does develop cancer in 10 years, there will be no way to definitively prove it was caused by the scans. The medical system will treat it as bad luck, as an unfortunate reality of aging. But the science is clear. Radiation causes cancer. The more you're exposed to, the higher your risk. The American College of Radiology and multiple other organizations have called for more judicious use of CT scans, especially in older adults. They recommend that doctors carefully weigh the benefits against the risks, avoid routine screening CT scans in asymptomatic patients, and use alternative imaging like ultrasound or MRI when possible, neither of which involve radiation. So what should you do? If your doctor recommends a CT scan and you're over 70, ask these critical questions. Do I have symptoms or a known condition that makes this scan absolutely necessary? Can we use a different imaging method that doesn't involve radiation, like an ultrasound or MRI? How many CT scans have I had in my lifetime, and what's my cumulative radiation exposure? If this is a screening scan, what's the evidence that it will improve my health or save my life? For lung cancer screening specifically, the guidelines are clear. If you're over 80, or if you quit smoking more than 15 years ago, the risks of annual CT scans likely outweigh the benefits. If you're between 70 and 80, the decision should be individualized based on your overall health, smoking history, and life expectancy. The bottom line is this. CT scans are powerful tools, but they are not benign. They carry real risks, and in older adults, especially those without symptoms, the cumulative radiation exposure from routine or repeated CT scans can cause more harm than the diseases they're meant to detect. The bigger picture, empowering yourself. So there you have it, 5 common health checkups that, after 70, may do more harm than help. Routine colonoscopies that can perforate fragile colons, PSA screenings that lead to devastating overtreatment of harmless prostate cancers, mammograms that detect slow-growing breast cancers that would never cause symptoms, routine EKGs that trigger cascades of invasive testing for benign findings, and CT scans that expose you to cancer-causing radiation while chasing shadows.